John, do you want to add to that?
I actually have one other point. You know, Lou Gehrig's disease, there's also a number of other illnesses, Alzheimer's disease, where people progressively lose their capacity. In those situations, it's almost best to, you know, when you know, as difficult as it may be, if you have a loved one that's diagnosed with Lou Gehrig's disease, multiple sclerosis, Alzheimer's disease, dementia, maybe a long time before they, you know, get to their critical state, but in those situations, people often lose their capacity, the ability to speak for themselves, long before they're, you know, near their terminal state. And in those situations, it becomes imperative to, you know, make those decisions, you know, early on when they still can.
I remember a story about a hospital in New York that was near a facility for, I think it was Alzheimer's. And every time somebody came down with something or pneumonia or their heart stopped, they were rushed to this hospital. And these doctors were just pleading for something to be done or about advanced directives, because they said what we are required or what we do to save their life is so horrendous or painful, invasive, and they said we would not do this to our own parents. And they were just in such pain in doing something that they knew these people probably might not wish. So there are a lot of decisions, and I think, too, it's interesting about how many young people, anybody, you know, you can get hit by a car or fall or something like that, and we tend to think of it as, oh, well, when I'm 90 or I'm going to live that long. It's so important. I wonder if you want to add, anybody wants to add anything? I know, Gail, you've had experience in hospice, in just, you know, the types of choices and decisions that we need to think about in creating that advanced directive. Anything else you want to add to that?
Well, I'd like to say for hospice, and actually with the healthcare reform bill, that there are demonstration projects where people won't have to be making an either-or decision. But let me clarify that, you know, most people think that hospice is like the end, and you're going to have to go off somewhere and it's all over. My experience has been is that people actually live longer if we get them early enough in hospice and not the last hour of life, which I frequently see. People dying in ambulances anymore, which to me is quite despicable. You have choice, so if you or a loved one need hospice services, there are choices, and hospices are as different as the hospitals, as the doctors you go to, as the different stores you go to. You know, you really should be an educated consumer and interview your hospice provider and ask them scenarios of what you would like in terms of either or. We have had many clients who have wanted IVs at the end. And part of the thing is that we look at what does this patient want and are we willing to do it. Some providers will, some others won't. Some people will provide feeding tubes, others won't. It is important that you know what you want for yourself, then go out and take the time to figure out what you want for your end-of-life care. We spend more time buying a car than we try to do to figure out what we want for end-of-life care. What's wrong with that? And so I'm putting the plug in for hospice because I've seen people live past that 6 month. Why? Because they're getting more care, and sometimes less is more. That's pretty much so.
Stella, did you want to add something to that?
Well, I just want to say that there is, having gone through this, you know, with my mother, there is a peace of mind in knowing that she had made these choices and that I carried out her wishes. I mean, there really is a peace of mind that I didn't just arbitrarily decide that my mother should or should not get this treatment or should not get that treatment or whatever. It's very difficult. It doesn't matter whether you're letting your dog go or whether you're letting your parent go or a child. It's very, very difficult to let anything go that you love. And so when you've had someone, especially a parent, make the choices ahead of time for you, then it's much, much easier for you to say, no, that's not what they wanted. Let's just keep them comfortable.
Yeah. Dr. Kirksey, you wanted to add?
Yeah, I would just like to add that, what she had mentioned about hospice, oftentimes, people do live quite a bit longer in hospice. Oftentimes we're faced with the decision if we're letting go, obviously, we're giving up that death is failure. You know, they stated before, you know, taxes and death are one thing that are always certain. And for me, success is more how people are towards the end versus whether they live or die, because we know everybody has an end. And so it's pretty certain, and so it's not necessarily a failure if they may live a shorter period of time, but they're happier while they're doing it.